Hi guys, so in today's lecture we will talk about brainstem syndromes. In this particular lecture we will mainly focus on three organs of your body. First will be eyes in relation to midbrain syndromes, second will be face in relation to pontine syndromes, and third will be even more important, a multi-purpose organ, that is your tongue, in relation to your medullary syndromes. In case of midbrain syndromes, there can be down and out deviation of eyes due to involvement of third nerve. In case of pontine syndromes, there can be facial palsy due to involvement of seventh cranial nerve, whereas in case of medullary syndromes, there can be involvement of hypoglossal nerve resulting into ipsilateral deviation of tongue as well. This tongue is a multi-purpose organ. Apart from taste sensing, apart from mastication, this has endless number of job to do. Due to scarcity of time in this lecture, I cannot enumerate each and every job of tongue, but this tongue can also help your marriage last longer. Let me explain it. Guys should restrict use of tongue and they should only use it to say sorry more than often, and ladies should also restrict its use by speaking less. So let's start. Having understood the medullary syndromes, now let's talk about pontine syndromes. Let's talk about Millard-Gubler syndrome. Let's talk about Fovili syndrome. Let's talk about Raymond syndrome. Let's talk about locked-in syndrome. Okay, so we are already done with this part. This is related to medulla oblongata. Now let's focus on this particular part because this is related to the blood supply of pons we have already discussed. So you have mainly basilar artery, you have superior cerebellar artery, and you have anterior inferior cerebellar artery. So what are the structures related to your pons? I mean vascular structure. You have mainly basilar artery, you have anterior inferior cerebellar artery, and you have superior cerebellar arteries supplying your pons. So any lesion related to these arteries will result into pontine syndromes. So we are going to discuss multiple pontine syndromes, Millard-Gubler syndrome in particular. Okay, so let's proceed. So here you can appreciate structure of pons, and we have already studied that sixth cranial nerve, as per your rule of 4, will be present in the midline, whereas other cranial nerve nuclei will be present towards the lateral sides. Try to appreciate. In this particular diagram, only appreciate presence of sixth cranial nerve right towards the midline, whereas other cranial nerves, that is 5, 7, 8, will be present towards the lateral aspect. And towards the midline, you also have your corticospinal tracts, that is descending tracts. Any problem related to these tracts will result into contralateral hemiplegia. Try to understand. In this particular condition, you have mainly Millard-Gubler syndrome. In case of Millard-Gubler syndrome, there will be involvement of 6th cranial nerve and 7th cranial nerve along with your corticospinal tract. There will be ipsilateral involvement of your 6th and 7th cranial nerve along with contralateral hemiparesis. So this is main syndrome related to your pons we will discuss. You don't need to understand each and every structure in the cross section of pons for the understanding of pontine syndromes. Try to appreciate. We will study Millard-Gubler syndrome, we will study Fovili syndrome, we will study Raymond syndrome, and we will study locked-in syndrome. So here you can appreciate facial nerve. For understanding of medullary syndromes, we focus on 12th cranial nerve related to deviation of tongue. For the understanding of pontine syndromes, we mainly focus on 12th cranial nerve and deviation of face, that is angle of mouth towards the opposite side. So now let's start with Millard-Gubler syndrome. In case of Millard-Gubler syndrome, there will be involvement of 7th and 6th cranial nerve. So there will be deviation of face towards the opposite side. Try to understand. There will be involvement of cranial nerve 7, that is your facial nerve. Along with this, there will be involvement of 6th nerve as well. But in this particular case, there will be no involvement of 6th nerve nuclei. Rather, there will be involvement of only fascicle of 6th nerve. So this will be related to involvement of fascicle of 6th cranial nerve, right? So in this particular case, there will be loss of action of lateral rectus towards the ipsilateral side, as well as there will be involvement of facial nerve, that is deviation of face towards the opposite side. Along with this, there will be involvement of corticospinal tracts as well, Therefore, there will be contralateral hemiplegia. So, in this particular case, there will be involvement of facial nerve, sixth nerve along with hemiplegia. So, what must be features of your Millard-Gubler syndrome? So, in this particular case, there will be ipsilateral palsy of cranial nerve 7 and cranial nerve 6 related to deviation of phase, related to lack of activity of your lateral rectus of the ipsilateral side along with contralateral hemiplegia. So these will be features of your Millard-Gubler syndrome. Now let's talk about second syndrome, that is known as Fovili syndrome. This is slightly different from your Millard-Gubler syndrome. Try to understand. In this particular case, there will be involvement of seventh cranial nerve resulting into facial palsy. There will be involvement of sixth cranial nerve as well. But in this particular case, there will be involvement of sixth cranial nerve nuclei, and because of involvement of six cranial nerve nucleus, there will be lack of horizontal eye movements. Try to understand. In earlier case, there was involvement of fascicle of six cranial nerve that was resulting into Millard-Gubler syndrome, whereas in this particular case there will be involvement of nucleus of six cranial nerve, and you guys understand that nucleus of third cranial nerve as well as nucleus of sixth cranial nerve are related, and if nucleus of sixth cranial nerve will be involved, this connection will be lost, and therefore in this particular case there will be loss of horizontal eye movements. So in this particular case there will be horizontal gaze palsy. There will be lack of conjugate movements because nucleus itself of sixth cranial nerve is getting involved. I hope you guys understand the internuclear ophthalmoplegia. So here you have again the same concept resulting into horizontal gaze palsy along with contralateral hemiparesis. So now you can appreciate that you have variant of Millard-Gubler syndrome. So now let's proceed. Your Millard-Gubler syndrome is your ventral pontine syndrome. In this particular case, cranial nerve 7, fascicle of 6 along with contralateral hemiparesis. Now let's talk about Raymond syndrome. This is related to medial pontine syndrome, and we have already understood that towards the medial aspect you have cranial nerve nuclei 6th as well as your corticospinal tract. So if there will be medial pontine syndrome, in case of medial pontine syndrome, other cranial nerves will be spared. Because this is medial pontine syndrome, there will be involvement of sixth cranial nerve along with corticospinal tract. So this will result into ipsilateral abducens nerve palsy along with contralateral hemiplegia. So this is like medial medullary syndrome, okay? But in this case, instead of 12th cranial nerve, there will be involvement of 6th cranial nerve. So there will be ipsilateral involvement of cranial nerve 6 along with contralateral hemiplegia. Now let's discuss last syndrome related to your pons, that is known as locked in syndrome, also known as pseudocoma. In this particular case, there will be quadriplegia, but your patient might be fully conscious. Try to understand. This can happen due to occlusion of basilar artery, and you guys understand that main blood supply of your pons happens to be due to basilar artery. Try to understand. This is your pons, and you guys know that there is only one basilar artery, whereas there are two vertebral arteries. Suppose this is your basilar artery supplying your pons. Suppose there is some clot over here resulting into complete loss of blood supply to pons. Now you guys also understand that there will be corticospinal tracts on either side near the midline. So this is your corticospinal tract, this is again your corticospinal tract. So both corticospinal tracts will be affected, and therefore in this particular case there will be quadriplegia. And you guys also understand there will be 6 cranial nerve nuclei somewhere near the center. So this will again not function, resulting into lack of horizontal eye movements. But in this particular case, reticular system, that is reticular formation, might be intact. Therefore in this particular case your patient might be fully conscious. Try to understand. This is your basilar artery, and in this particular case there will be problem related to your basilar artery resulting into complete loss of blood supply of your pons, resulting into quadriplegia, resulting into loss of horizontal eye movements due to involvement of 6 cranial nerve. Not only this, because there is complete loss of blood supply to pons, it will also result into aphonia. It will also result into horizontal eye movements we have already discussed. But in this particular case, your patient might be fully awake because your reticular formation might be intact. Try to understand, in this particular case, there will be no horizontal eye movements. Plus, this can also involve your corticobulbar fibers. By saying corticobulbar fibers, I mean that you have your midbrain, you have your pons, and you have your medulla. In this particular case, we are dealing with pons. And in this particular case, there can be problem related to corticobulbar fibers as well. Suppose this is your cortex, and from cortex to medulla, medulla is also known as bulb, there will be fibers going from this pons. So in this particular case, these corticobulbar fibers will also be affected. And what is bulb? Bulb is your medulla, and this is related to your 9, 10 and 11. That is related to vagus nerve, that is related to glossopharyngeal nerve. Therefore, in this particular case, larynx innervation will also be absent. Therefore, in this particular case, there will be aphonia as well. Along with this, we have already understood that this patient will be having quadriparesis. So there will be no movement at all. So therefore, it is known as locked in syndrome. And this is known as pseudocoma because in this particular case, patient might be fully awake because patient's reticular system might be fully functional. But in this case, only horizontal eye movements will be lost. Vertical eye movements might be present. So in these cases, vertical eye movements along with blinking, that is eyelid movements, might be intact. Always try to remember the case of Michael Schumacher whenever you study about your locked in syndrome, that is known as pseudocoma, because in this particular case, patient will be fully conscious. Okay, now let's recap. In case of Millard-Gubler syndrome, we have already studied that there will be involvement of two cranial nerves, that is cranial nerve 7 as well as cranial nerve 6 as well as corticospinal tract. In this case, there will be mainly involvement of your anterior inferior cerebellar artery, right facial, and this is related to your anterior inferior cerebellar artery. Here you can appreciate in reverse order, you have anterior inferior cerebellar artery. Okay, so this ICA is involved in case of your Millard-Gubler syndrome, where there will be involvement of facial nerve.